everyone, I'm Noelle Hernandez, and before we start today, we're actually going to remove our masks because we are sitting 6 feet apart and social distancing. So I'd like to introduce today our guest, Suzanne Villalobos.
Hi Noelle, how are you doing?
Good, thank you for being here. Today we're speaking with Suzanne Villalobos, who works at Advent Medical Group with Stetson University in Student Health. She comes to us with an undergraduate from Purdue University with a bachelor's in science dietetics, a master's from University of Florida in physician studies, and has been working in Deland in family practice for 18 years, and actually is a mother of 4 with 2 girls herself. Now let's jump into some questions. As women, it's obviously very important for us to understand how to age beautifully, but more importantly, healthy. So can you talk a little bit about why women should see their medical provider every year, maybe even if they aren't having any medical issues or conditions?
Sure. It's important to see your medical provider every year just so you can get to know each other. That'll come in really handy. If something does come up later, you'll feel comfortable talking to your provider about that. The other things that we do when you come in for wellness visits, it gives us a chance to assess for risk factors and things that could cause future problems. It gives us a chance to talk about vaccines that you might need to have updated or maybe new vaccines that have come out. And it also helps get some insight into how to live healthy.
And that's great information. Thank you so much for that. You mentioned that there are several screenings that might be necessary. Can you talk us through some of those?
Absolutely. The simplest screenings that we do are your blood pressure and your weight. Although they seem kind of mundane, it does help us assess your risk factor for several chronic diseases. The other thing that women need in particular is their PAP every 3 years, and that can stop depending on your age and other factors. We do some blood work, and with that we're looking for cholesterol screening, we're checking blood sugar. Both of those can go on to cause heart conditions, so we always like to keep an eye on that. We'll ask you kind of personal questions about how you're handling stress and how well you're sleeping, and those have also been found to lead to other conditions. We're going to ask about your alcohol use and tobacco use, again looking for risk. We're going to ask you about your family history, and that's really important because that tells us if you're more at risk for some diseases than maybe some other people. We're going to ask you more personal questions. We're going to be looking into safety things, like do you use your seatbelts, do you use sunscreen, do you have a smoke detector? Those are also really important for your health. For our more mature ladies, we're going to be asking about fall risks. We're going to ask about the medications they're taking, especially since a lot of more mature people see several specialists that we may not always know about. Colonoscopies are probably what no woman wants to hear about, but also super important. And the risk for that, or the risk for needing a colonoscopy, changes with different things that we'll be talking about during our assessment and our screening.
So that sounds like a lot of things to cover within that visit. Do providers typically have the time to go through all of that within one visit?
Well, it's really important when you make that appointment that you set it up as a wellness visit or a physical. That way it allows the office staff more time. In some offices, several staff members help us complete these assessments, including the nurse or the medical assistant. In some offices, they'll even do part of this over the phone because it's sometimes risky to bring the older patients into the office for such a long visit.
That's great. So you actually mentioned something about vaccines. Were you speaking specifically to COVID-19 or are those vaccines in general?
Oh, ma'am. The COVID vaccine I think is going to be a super important part of this, but right now the approved vaccines are really important. The youngest women that we deal with need to be sure they have the HPV vaccines. Those have been shown to prevent cervical cancer. Everyone knows about the tetanus shot because you have to get that when you step on a rusty nail, but you actually need it every 10 years. And some women need the combination with the pertussis or the whooping cough because you could expose yourself to infants, especially important if you have grandchildren. Shingles vaccine comes into play also around midlife, and women need to get that. The more mature women need to be sure they're getting their pneumonia vaccines once or twice, and everyone needs to get a flu vaccine every year.
Which reminds me, I need to make my appointment, so thank you so much for that reminder.
Yep. That time of year.
So some of the women that I've spoken to who are overweight feel like sometimes when they come into the doctor, they are getting lectured about being overweight. Can you just speak to why it is so important to talk through some of those eating habits?
Absolutely. I know it's awkward to discuss weight, especially with someone else, but it is super important. It's important because a lot of the cancers that we find in women are associated with extra weight. Along with extra weight comes the increased chances of being diabetic, which can lead to heart disease. Your primary care, your medical provider, should definitely be working with you. You guys should work on this together to find the best, healthiest eating habits. It also involves looking at the foods you eat, so they're not just being nosy, but a lot of foods, the more processed foods, have an increased chance for cancer. So that may be why they're asking you about those. But it definitely should be something that you're working together to find the healthiest habits. And if you feel uncomfortable talking with your medical provider, or you're just not making enough progress with that, always ask them for a referral, someone else maybe that they can talk to, maybe a dietitian. But this is overall, it's for your best health or for your friend's best health.
So we've covered some of these physical components as to why we should see a medical provider every year, but can we talk through some of the mind and spirit side of that?
Absolutely. So part of our assessment is looking for signs of anxiety and depression. Who hasn't at least been anxious in the times that we're in now anyway? One of the things that we'll definitely be talking about with this is physical activity, because physical activity can help reduce some of the anxiety. It's a really good way to get a lot of that out. And it's also been shown to help with depression. So your provider can help evaluate what's safe for you to do physically and what's going to be the best for you.
That is great information. Thank you so much for that. And thank you again just for being here today and talking through some of these really important subject matters with us.
Thank you so much for having me, and I just want to be sure that all the women understand how important it is to take care of themselves, because we are truly the glue that holds our families together, and if anything happens to us, it would be really detrimental. So our physical health, our mental health is all very, very important to everyone around us.
Thank you so much, Suzanne, for your time today. And thank you everyone for tuning in today. We hope that you enjoyed this information.